Welcome to Cut the Bull, an insightful podcast which addresses the news of the day and the cultural issues plaguing our society, bringing logic and context to these topics and discussing solutions too real for mainstream pundits. Now, here are your hosts, Charles Love and Wilfred Riley.
Hello and welcome to Cut the Bull. I am Charles Love alongside my co-host Wilfred Riley. Here for some medical tips is Lou Perez, and our guest this week is Dr. Kenneth Kim, board-certified plastic and reconstructive surgeon and assistant clinical professor at UCLA. Dr. Kim, welcome to the show.
Hi, nice to meet you guys.
Well, it's nice to meet you. You know, Will and I, we've been talking. It's like, I want to get a doctor on so we can talk about all things medical, both from what the problems are, what's good, what they think about what other people talk about medicine, some innovation down the road, and all those kind of things. But then, and hopefully we'll get to some of that, but you came to me through an interesting topic. You're a plastic surgeon. Obviously, surgery is, whether it's elective or not, can be a serious thing. And I was sent this talk you did about the problems with general anesthesia and how, obviously, we think, you know, anytime you're going to take medicine, it could be a problem. But you say that these problems, there are problems that people don't think about. So talk about those concerns, the pros and cons. And the one you talked about, which was new to me, was that it may lead to dementia.
Yes. So, surgery. So there are two types of risk. One is a surgical risk, and then other is a medical risk, which is an risk from anesthesia. And so surgical risk is when a surgeon makes an error, but the devastating complications that can happen are really due to problems from anesthesia. And so there are two types of anesthetic risk. One is a risk that happens to your body, and then the other is a problem that happens to your mind, to your brain. And so to break it down, so the major bodily complication that can happen is obviously blood clots, because you're immobile. So when you're immobile, then your blood tends to clot. So a classic example is like if you ride in an airplane for a really long time, let's say you're doing like international flights, you're told to kind of walk around because you don't want to just be stagnant. Mm-hmm. And so blood clot, people can develop that. It could go to your lungs, and it could cause a pulmonary embolism. You could also have a heart attack. You could have a stroke. So these are serious medical complications. But there's another issue that people are not aware of, and that being memory loss. Mm. So people think, oh, you know what? I didn't have any complications after surgery, so I'm okay. But what people are not aware is that the data, the research that's been coming out for the past now, like 20 years or now, is showing that people undergoing general anesthesia or IV sedation for more than 2 hours develop memory loss, because what the anesthetic is doing is that people think that, oh, I'm just going to go to sleep and everything will be okay when I wake up. But the anesthetic, it crosses the blood-brain barrier. So what that means is that it kind of goes to your brain cells. And what it is doing is that it's not only putting you into a deep state, but long-term complication is that it kills neurons, which are brain cells at the hippocampus, which is the memory-forming part of the brain. So essentially, to make it simply, your short-term memory. So we have long-term and we have short-term. So long-term is like what you remember during your childhood. Some memories are just ingrained in you, and those are long-term. That's why people with dementia, they could remember the past. But people with dementia can't remember what you said to them maybe an hour ago, or what you said to them even 10 minutes ago. And so we rely a lot on short-term memory. And these are like, oh, what was that person's name, that the person I met 3 months ago? Or somebody gives you a phone number and you have to recall that number right away. Mm-hmm. And so any surgery lasting over 2 hours, or people receiving multiple surgeries, are also heavily affected. And and I think that people should just be aware of that. And so some people may say, well, I'm young, I'm okay. But right now, the data is showing that people over 60, 65, they are the vulnerable age, and people who are very young, so like infants and the people, young people, people who are developing, where their brain is developing, so adolescents, so they're also, it's bad for their brain too. So what I'm saying is that if it's bad for if it's bad for people over 60, 65, it's bad for infants and kids, it is not good for adults either. And the reason is that the research is clearly showing that it is killing nerve cells at the hippocampus. And so then you could say, well, I had surgery and I was fine. I didn't experience any memory loss. And the reason for that is because when you're young, you have tremendous reserve of brain cells. But then as you get older, that reserve gets less and less. So it's like a young football player gets a concussion and they get knocked out, and the young football player can bounce right back. However, if like a 65-year-old, get knocked out and develop a concussion, that person is going to have a significant brain damage. And so, so I think that these are some of the things that I think patients should be aware of, and also to know that there is an alternative to that.
Okay.
And the alternative being, doing it under local anesthesia. What that means is that you don't have to be put under, and there's so many other positives to that. So also, I want people to be very clear that I'm not suggesting this for all types of surgery. So, I mean, obviously, if you need surgery and emergent surgery or major cancer surgery or trauma surgery, then by all means, do what needs to be done. However, if you're doing an elective cosmetic surgery or just an elective procedures, even like in orthopedic procedures where a surgeon can do it while you're awake, then why not do it that way? And I think that more the patients are aware of it, then they could suggest to their surgeon, hey, can I do it this way?
Right. I got questions, but I want to see what these guys have to say first. I
was
look like you're chomping.
Well, I was gonna ask, like, you guys, well, I guess everyone here. I mean, as you were talking, doctor, I was running through all the times I've been put out, and trying to like kind of like, okay, how long was I put out? Because I've gotten my stomach checked, for example, and they put me out, but it's like a 15-minute thing. So I'm like, okay, that's good. And then I've had surgery on my my nose, So then it was like, I was like, okay, I was awake for that, so I'm like, so I think I'm all right, and I'm like, and hopefully I stay that way, and we'll see how much of this I forget as we're going on. So.
Yeah, I guess so. I mean, like, two comments. First is a personal comment. I've never actually been put out because I almost never go to the doctor, which is something I plan on.
He does not want to hear that.
No, but it's something I plan on revising this year. But I mean, as a healthy young male, like, I looked at the stats and I was just like, I don't really know how much time I'm going to spend getting, medical work done. But I think one question that comes to my mind for Dr. Kim is, I mean, you mentioned going for local anesthetic instead of general anesthetic, but do you think there should be any kind of limits on the sort of medical procedures that people can engage in? I mean, like, prepping for the interview, the USA obviously has a for-profit medical system, world-leading medical system. So we seem to use like 45% of the psych meds. One of you guys might correct me, in the entire world. We give 70% of the Brazilian ass lifts in the world, whatever the technical name for that procedure is. Should there, doc, be any kind of limits on what people can do, or should patients just be aware that there are risks when you go into a doctor's office, which I don't think a lot of middle-class Americans are, in all honesty?
Right. I mean, I think that, one of the things that really kind of bothers me is when people are not aware of things. So before the talk, we we're talking about me being an immigrant and what kind of drove me to do all this. And one of the is that when my parents owned a convenience store, and then so they worked 7 days a week. So I was home alone. And so since I was like 12 years old, I had to kind of make my own dinner and, things like that. And so after school, what I would eat is I would eat these like processed like cakes, junk food, like from like processed like Twinkies and things like that. And my parents would always bring them to me because they knew I liked it. And it was for them, it was like a sign of love because they're like, oh, he's home alone, so he's hungry, so why don't he eat that? But so I ate that, but my parents and I didn't know it was not good for me. But now we know that these processed food is really bad. It raises your glucose level. It's just tons of omega-6s. It's just it's really bad. But so what I'm saying is that now as an adult, I mean, I think, and as an MD, as a doctor, I think that we just have to let people know. Now, if people know the risk and they still want to do it, we live in America. This is a free country, and people should be able to do what they want to do. If they want to, like eat a lot of bad food, then we can't stop them. And in terms of like limitations, again, it's important that we just inform the patient and give them options, and I think of my job as a plastic surgeon or as a doctor or as a surgeon is that, my job is to give you all these options. I'm like a guide taking you. Mm-hmm. And I'm telling you that we have this path, we have this path, and we have this path. Mm-hmm. And as a guide, the person who's going, they don't really know what is a safe path. And so it's the guide's responsibility to tell them the risk and then recommend the safest option. Right. And according to the Anesthesiology Society, local anesthesia is considered the safest because there really is no real risk to local anesthesia because you're just numbing that area. Plus, the recovery is so much better too.
I have a follow-up question, but I don't want to step on Will's toes, and I think he might have the same question. You good? Or you want to go?
Well, I had more a comment, which is that I tend to agree with Kenneth, with Dr. Kim on that. Like yes, you have a right to freely choose things in the USA. I do think we'd all agree with that. The point about calories, the content of a lot of the food that Americans eat, though, does kind of resonate with me because I remember maybe 10 or 12 years ago, restaurants started putting the actual calorie content of their food on menus.
And no one stopped eating blooming onions, side note.
Yeah, but that was one of the things. Like, I mean, this was at a point where I was still dating, and you'd go to like a steakhouse. The blooming onion, I think that's 4,600 calories. So yeah, there's gradually more of an expansion of the knowledge that people can access, which as an investor and all that, I think is very good. Right. But people were at least shocked by much of what they'd been doing. And you have to wonder about the extent to which that would be true in medicine as well. If there's full upfront, like these are all the options, these are the price ranges, so on down the line, which is something that insular elite industries, medicine certainly, but the funeral home business, many different sets of players in general don't always do. But that wasn't a question at all. Charles, what was your question?
Oh, what I was going to ask was, I think he asked a large part of your question really well, and I agree with it as well. But I still think people can select what they want, but surgery and medicine is a little different in the sense that the person doesn't know as much. So like Dr. Kim says, it's my job to guide you and give you the information, but not to get off the topic because we got a bunch of off-ramps to go down soon. I'm looking at Lou, but obviously a lot of conversation now is around gender and all this kind of stuff. So I just think of it like, what if I'm the surgeon and I don't think you should be doing what you're doing. So it's one thing to guide you for the best course of something you want to do, and it's free country, you should be able to do it. But how would you go to tell somebody you really shouldn't want to do it? Or when do you, as a surgeon, just say, okay, I'm not doing it? Or okay, gender might be too toxic for some people. You're a plastic surgeon. Somebody wants to get a nose job, and you recommend with the best path, and they're on like their 8th one, and it's Michael Jackson level, right? At some point, do you say, okay, it's time to stop?
Right. So, I mean, I think the way I look at it is that, everything has a plus and a minus, right? Mm-hmm. And long as the plus significantly outweighs the minus, right, then I think it's good to go, right? With any decisions we do or anything we do in life, it's not about surgery, it's about just the way we live life, right? Mm-hmm. And so the way I looked at surgery was that, surgery has not significantly changed in the past 100 years, the way we perform surgery. So what I mean by that is if you look at technology, the world has remarkably changed in 100 years, yet we still put people to sleep and we still have patients take all the risk. And then we say, well, it's just part of surgery. I mean, if you develop a blood clot, if you have a heart attack, oh, it's just part of surgery. If you have memory loss, we don't even want to acknowledge it.
Right.
Just to give you a quick little, just a brief, just a history lesson, but the coal miners were complaining that being a coal miner was bad for their lungs. They felt like their lung was not healthy. And AMA, the American Medical Association, refused to acknowledge that until the 1970s. So, I mean, it's just like you don't have to be, and same with, traumatic brain injury, like medical community didn't really acknowledge that until more like in the past 10, 15 years ago. And then with that, the NFL started to change.
Right.
And, so I think that, the way I look at it is that why do we have to put patient nearly in a comatose state while, so what we're doing is that we are significantly changing the patient's physiology. So what that means is that we're changing their body function to do the surgery. So we think automatically, you know what, if I'm going to cut into you, of course I have to knock you out. Of course we have to change your body function, right? But what I'm saying is that our body our body function doesn't like to be changed. So surgery is all about changing our body's anatomy. However, the difference is the physiology, which means the body function, and our body was not designed to be immobile. We're meant to be moving around, and our body does not like to be put in this deep comatose, deep sleep. So when you're sleeping, so people think like, well, I sleep for 6, 8 hours, 10 hours, I'm fine. But again, when you're sleeping, you're not immobile. Right. Your legs are moving, you're tossing and turning, and so the muscles are pumping. Whereas in surgery, you are immobile. That's completely different. And again, when you're sleeping, when somebody yells at you, somebody shakes you, you wake up. But in surgery, you're put into such a deep sleep that somebody can cut into you and you don't wake up. And that has ramification. And what I'm trying to say is that we don't have to accept that status quo. The progress is all about refinement, and refinement is taking away the bad and adding the good. And again, if I say, well, if we do it under local anesthesia and the result is worse, then I would say, okay, then maybe you should do it under general anesthesia. However, the surgical result is way better. Right. Then you could say, how could that be? How is it that if you're awake, the result is better? Does that make sense? And the reason is that when you're awake using local anesthesia, you have to numb up that area that you're operating. So you could only stay within that area. Right. So the surgeon has to be much more precise. Gotcha. If the surgeon deviates and makes an error, the patient will be like, ow, I felt that, because you didn't numb up that area. You're only numbing up the area that you're operating. So you undergo much less trauma in your body. So the surgeon has to be more precise. Gotcha. Number two is you have much less bleeding. So an infection rate, because what happens is that during surgery, what happens is that this is getting a little technical, but during surgery, what happens is that your blood pressure drops because the nature of having general anesthesia, your blood pressure just drops. And so when the blood pressure is low, then the surgical field where we're operating, they don't bleed as much, even though they do bleed. So then when the surgery is about to be finished, the surgeon will say, oh, okay, I think all the bleeding is stopped and I'm going to close the patient and that's it. But we all hear about patients having post-operative bleeding or post-operative hematoma and things like that. And that's because when the patient's blood pressure goes back to normal, then the small vessel starts leaking. And that's why people develop, bruising after surgery. Whereas if you're awake during the surgery, that blood pressure doesn't go up and down. So if there's any bleeding, then the surgeon can just stop the bleeding right away. So there's none of that, right? And blood is really bad for our body because the blood belongs in the blood vessels. But if the blood is outside the blood vessels, then your white blood cells has to come in and take away that red blood cells. And when the white blood cells are activated, by definition is inflammation when white blood cells get activated. And we all know inflammation is bad because it causes a lot of scarring and all that. Yes. So it delays healing, the result's bad, and then the result is just not as clean. So, and lastly, about this, I think we're mentioning about America being number one in all these bad things. Another thing that America is number one is opioid abuse.
Right.
And right now we have an opioid epidemic, and people are blaming fentanyl crossing from the border and things like that. But what we're not admitting is that opioid, the reason why people are addicted, a lot of the cases is because they've been introduced by their doctors. Right. So when the patient undergoes surgery, patient has pain, and what we do is we just give them opioid pain medication. And the CDC is saying that about 1/4 of the surgical patients take opioids for more than 3 months. That is horrendous. That's an addiction right there. So 3 months. So there's no reason they should be taking it that long. Versus if you're under local anesthesia and when you're awake, then patients really don't need opioid pain medication. So my typical patients will take Tylenol maybe a day or two, maybe even a few days, and that's it. So I rarely prescribe opioid medication because the surgery is so much more precise. You have to be so much more precise. And second reason is that the nerve fibers are blocked before you're cutting. So remember, when you're under general anesthesia, your brain is numb, and so your body feels the pain. It's just that you just don't know because your brain is numb. And if you don't know that, and then so what happens is that when you wake up with pain. So if you ever go to a recovery room in the hospital or surgery centers, you'll see people like in agony. And the first thing the recovery nurse does is they give you the pain medication, IV pain medication, strong IV pain medication like fentanyl. But what happens is that because they are experiencing pain, but if you're undergoing local anesthesia, because the nerve fibers are already blocked, that nerve fiber is not activated. So after the surgery, during surgery, you don't have pain. After surgery, you don't have pain. And so you're not experiencing this up and down. Right. Versus you undergoing general anesthesia, then you get the pain, you have to take the opioids, and then you go up and down and you get this nausea and grogginess, dizziness, vomiting, right. And then you're just constantly, and then some people are just prone to addiction too. Right. So for all those reasons, yeah.
Let me get Louie and Lou. I don't know where you want to, I mean, we'll miss the part. We want to save it for tape. Do you want to talk LA or you got a medical question?
Oh, I have a medical question, I guess. So the question I have is, what are some types of surgeries, in your field or, in another field that the norm is to do it under general anesthesia, but you believe that it's better to do it under local anesthesia? Because I think there's probably quite a few people who are going to be listening to this who might have a surgery coming up and they might be like, say like, oh, I didn't know that was necessarily an option.
Sure. I mean, first of all, I'll speak from my field first. So, and then I'll speak about other fields as well. So in plastic surgery, so I do cosmetic surgery. So I do facelifts, I do eyelid surgery, I do rhinoplasty, breast surgery, tummy tucks. And so I do all of them awake. And so like, I'll give you an example. Like if you're doing a facelift, for instance, so what is a facelift age or anti-aging age group? They're typically in their 50s and 60s, right? Or even up to 70s. And, again, they're at the vulnerable age group for developing dementia in the future. And, the Alzheimer's Association is predicting that by the year 2050, so that's a little bit more than 25 years from now, so 27 years later, the incidence of dementia is expected to triple that current rate. So what that means is that it's not going to double in 27 years, it's going to triple. So dementia is like a major epidemic here. It's a major problem because we are, even though you have children, not every parent can rely on their children to take care of them because sometimes their children are living in, different states. Some people live alone. Some people don't have children. And, if you have dementia, that is a tremendous problem for the person, but it's also a tremendous economic burden to our society here. And so why is dementia exploding right now? And I'm not saying it's all because of surgery. I mean, there's many, many factors, but I think right now we do have to hit one at a time. And, so surgery, so something like elective surgery, like a facelift, because I think right now people want to look young, and these elective procedures, remember, elective means they don't have to do the surgery. They're doing it because they want to improve the quality of their lives. But I think that if they are going to damage their brain cells, again, the research and the scientific data, the studies are conclusive right now that it is killing neurons. If you look at all the animal studies right now, is showing it. Then I just don't think it's worth it. So if you do it awake, then I think it's just the way to go. So cosmetic surgery. So plastic surgery has cosmetic and reconstructive. Again, I'm talking about elective procedures because an elective procedure, a surgeon can pre-plan and say, okay, I'm going to cut here, I'm going to enter here, I'm going to do this, and then I'm going to go out. So it's almost like being a race car driver. A great surgeon who's doing an elective procedure, whether it's plastic surgery or different surgery, because it's elective, they could plan. So like a great race car driver just knows that every turn of each bank, what angle is going at, how steep, and at what speed they could hit that without skidding off. So a great surgeon would know that. And that's what differentiates a great surgeon versus somebody who may not be, because great surgeons are so meticulous, right? They look at every single detail. And, often I hear like sports commenters saying like, oh, that was a surgical strike. That was a surgical pass. And I'm like, sometimes it makes me like just laugh because, not every surgeon is performing at that level. And I think that elective surgery is like that. And I think that we should demand more from our surgeons. Now, again, if you're doing reconstructive or if you're doing something that is like cancer surgery or something that is not elective, by all means, do what you need to do. Because for those, I consider those as off-road riding. You don't know what you're going to go into. But for elective surgeries, facelift, breast augmentation, tummy tuck. Again, tummy tuck is really important because tummy tucks, these people have a higher incidence of blood clots because you're kind of strangulating the stomach, you're tightening up the muscle. So you have increased intra-abdominal pressure. So the data is showing that these people have a much higher incidence of blood clots. So for all these reasons, I think elective cosmetic surgery should be done should do it while you're awake if possible. Now, even surgeries like orthopedic surgery, you were mentioning about you had like, septoplasties or not, perhaps you may not have had that, but, people are realizing that we should move away from general anesthesia. So even in orthopedics, if you're doing like joints, knee surgery or hip surgery, more and more people are trying to use like a spinal epidural where they don't put them to sleep.
I have a question real quick based on something you said at the end. You talked about the sports analogy and how they say surgical strike and all surgeons aren't created equal. And it made me think, because at the beginning you talked about, obviously we brought you on to talk about the dementia and we're talking about general anesthesia a lot. But in your preface to explain it to the layman like myself, you were saying that there's two risks. There's the risk to your body and to your brain from the medicine, and there's the risk from the surgery itself. So I wrote about, I don't know what the numbers are like now in post-COVID and all that, but I writing a book about how people assume things bad. We talk about stats all the time, police shootings and all this other stuff. They think they're worse than they are. But then I was using an example to talk about all these things, these risks around you that you don't pay attention to. And in doing the research at the time, this was 6 years ago, I don't know what it's like now, but they said there were 250,000 people that died every year from surgical errors, right? And no one ever thinks about that. No one ever knows that. So that's to your point about them not all being equal. And you also said that surgery hasn't changed in 100 years. So all that together, I want to ask, how bad is it out there? I mean, how concerned should, I mean, people are always concerned when they go to the doctor, but they don't really think about what goes into it. They think all doctors are the same. We did an episode about credentializing. It's like, well, he's a doctor. There's no difference. Once you say you're a doctor, they're all the same. So talk a bit about those risks on the other side, being from surgical error, and just maybe how pervasive it is, or, you know, how you can vet a doctor, or just is it why people don't realize that it's a concern.
Sure. So yeah, so surgical
You just saw your face. You were like, whoa.
No. Because see, the surgical error is a different topic, but I'll be happy to talk to you about that. Mm-hmm. So the surgical error, remember, surgery, I think people try to make surgery into some mysterious thing, but surgery is not. You know, you have to just break it down. What is surgery? Surgery is something that we're doing with our hands. It's actually almost quite, I would say, primitive. I mean, it's a hand-eye coordination. You know, you're cutting this and you're moving this, you're taking out a tumor, or you're moving this tissue around. In plastic surgery, we cut a lot and we sew a lot. Mm-hmm. And anything where you're doing, when it deals with hand-eye coordination, where you're moving, one of the biggest reasons why people make a mistake is poor visibility. So when you're driving or when you're flying, why do people get into accidents? Why did a helicopter pilot for Kobe Bryant get into a crash? Why did John F. Kennedy Jr. get into a crash? A lot of it is because of, unless there's some major engine failure, a lot of it has to do with human error. Mm-hmm. And the human error tends to be it happens when there's poor visibility. Again, so when you're driving in a massive fog and it's snowing. I mean, it is really dangerous, right? And at a certain point, it becomes so dangerous, you just have to pull off the road, right? And what happens is that during surgery, especially when you're operating around the face, our face has a lot of blood vessels. And if you cut a blood vessel, what happens is that the blood leaks out and it stains the surgical field, it stains the area. And then so you can't quite see as well. And as you're going further, you hit another blood vessel because you couldn't see. Now rather than one blood vessel, now two blood vessels popped. And then now you stained it, now double the stain, imagine, I'm just simplifying. And then you go further, now you hit another one. So as you're going further and further, you're hitting more blood vessels. And not only are you hitting more blood vessels, you're now hitting other vital structures such as nerves and things of that nature. And so that is a surgical error. And the number one reason why anybody makes an error, whether you're driving or anything, is poor visibility. And the good thing about the reason why I advocate doing it awake is because under local anesthesia is that, again, the surgeon you have to be precise from the beginning, right? Because if you start being rough and you start speeding, then the patient will feel it.
They'll feel it.
So you have to start meticulously, and from the beginning, it's like great art. You know, the great artists, they don't just look at the end product. The beginning has to be beautiful and clean. And then the process, they also want the process to be clean and beautiful. And then the final product is beautiful as well. Right. And that's like a true artist, right? So surgery too, when you're entering, you want to enter cleanly, and during the middle, it has to be clean, and the end has to be clean, meticulous. And And so I think that, yeah, you would have significantly better, that's why I'm saying better surgical outcome.
Well, do you think that innovation is going to help with that? I mean, will they be a way that down the road they can eliminate the human error by having machines that take away some of the human element?
So right now we have robots that help us operate,
Mhm.
and it's made by it's called Da Vinci. It's a robot. A
Mhm.
lot of people use it, but the thing is that again, robot is controlled by a person, and with the future of AI, let's just say the robot will control by itself. However, the robot still need vision, right? I mean, imagine you have an autonomous driving, right? Right now, Tesla, for instance, is going all vision because Elon Musk is saying vision is the way people move, right? So vision is better than radar or lidar, something that's giving you a signal. In our body, we don't have metals to give us signal, right? So we need vision, right? And so even AI needs clear visualization. And I think that precision is just paramount. And I think that a surgeon should just be and then also a lot has to do with speed. So you cannot rush through surgery. And if you're under general anesthesia, you could kind of blast through surgery. So I'll give you an example. So I have a colleague who can do a breast augmentation in 8 minutes. I have seen that. Okay.
How big are the titties?
So in 8 minutes, right? And so can you imagine this is from skin to skin. You're cutting, you do everything, and then you're closing in 8 minutes. Okay.
Wow.
So one of the very fast person was saying he could do it in 15 minutes, and I seen him do it in 16 minutes, and I saw one of my colleague doing it in 8 minutes. Again, the patient's under general anesthesia, so you're just kind of blasting through. So if I tell you, okay, I could get to somewhere on a freeway or on a road, and if I want to blast through, I'm just going to put pedal to the metal. I wouldn't care if I'm not in the lane, long as I get there, right? So I'm not going to be in that perfect lane. However, if I tell you, you must stay in that perfect lane because you're driving with your mom is like 80 some odd years old. She's going to have a heart attack if you drive recklessly. You're not going to drive recklessly, right? And you will just say, okay, I'm not going to put pedal to the metal. So when you do that, you're going to be much more precise. And I think right now, the surgery, the way medicine is right now is that surgeons are paid per case. Lawyers are paid per hour. Mm-hmm. So whereas surgeons are paid per number of cases you do. So financially, it makes sense for you to blast through surgery, right? I did, let's say if you do 8 minutes or 15 minutes or even 30 minutes for breast augmentation, you could just go bang, 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 and you could do 5, 8, 10 breast augmentation a day. You just line up the patient versus you being extremely meticulous and taking your time to do it. Then you could only do maybe like 2 a day or, so right. It's about that too. And you're asking about like, how to pick a surgeon and things of that nature. And I think, one of my patients asked me, like, she's like, I wanted to know, like, how do you even pick a surgeon? Mm-hmm. And I think, it's not only about how do you pick a surgeon, it's about like, how do you pick anybody?
Right, any professional.
Who trust you to do the job for you. Because, if you're like right now, like I'm like kind of redoing my front office, right? Mm-hmm. And then so I need to hire somebody to do certain work. It's like, because I don't know all the technical aspects of the contractor's work and things like that, right? And surgery is even more, right? But I think what it is that it's not just the schooling and things like that. I think that a surgeon's schooling, what that tells you is, were they very studious? Were they like disciplined? Or, were they, like, did they work hard, right? Because in medical school, you cannot get into a good medical school if you have a bad grade point average in college. So in medical school, if you could have the great MCAT score, which is a test you take, so you could be brilliant, but if you don't have a good GPA from college, you're not going to get into a top medical school. So I was in the admissions committee where I went to medical school, and so I went to Yale, and there, as I said, and it's not only my medical school, it's a bunch of other medical schools will say, and the reason is that good GPA shows diligence, perseverance, and sincerity, because you're being consistent, and you want surgeon to be consistent for one, and I think number two, probably more important than even schooling, is how dedicated are they to the field. So are they doing it for flash? Are they doing it for money? Or are they doing it for whatever prestige? Or are they doing it because they really believe that it is a calling? And I think medicine really is a calling, because, to do advances in medicine, it is so painful, because there's so much regulations, and every dot has to be dotted, and T's has to be crossed. And there's so much information you have to process to make something happen. And, it requires a lot of sacrifice. And so you have to see, is this person that committed? Is that person willing to go all out, right? Are they like all into this thing? And because, somebody's going to cut into you. And so, yeah.
I got more medical questions, but Lou, I mean, obviously you got to say something. We can't leave without talking about the Korean convenience store owner in LA. I mean, he's got to have a story or something, right, Lou?
Yeah. Well, I just want to say that this came from the pre-interview. This is not us being bigots and stereotypes. Yeah, profiling you. The doctor has a story of humble beginnings that we found very interesting, and I think Will find it interesting, as well as everybody listening as well. So.
Yeah, no. I mean, so what it is that, again, coming here, and then my parents, having a convenience store, and then having to, since my adolescence, I had to eat dinner by myself, because my parents work 7 days a week. Mm-hmm. And so, I was just eating dinner by myself. We didn't have Thanksgiving dinners. Christmas was a busy time for a convenience store. So my parents were, and then so, and the way I looked at it was, why does life have to be this way, right? And then also there's a lot of crime. LA was where my parents had the store. It was dangerous. There's drive-by shootings and things like that. And then so, I said, what is the most ideal situation? The most ideal situation is that as a kid, as a 12, 13-year-old, shouldn't be standing. And I was selling I was selling cigarettes. I was selling beer. I mean, it's probably illegal right now, but at that time, I was selling all these things. And then suddenly there's drive-by shooting going on. And I'm like, oh, the window's broken. I mean, I'm not even thinking I could have gotten killed. Right. I'm like, oh, I have to now change the glasses here. We need to call a glass person again.
Wow.
And, but then you still have to be working. Right. And then we get robbed. And then, my mom had a really bad heart. So she would have a lot of chest pains. And then so I was like, what is more optimal? So I kept on thinking so I said, when I grew up, hopefully I could become a doctor. And then, my future kids don't have to undergo all this, right? And then, so when I was in medical school, again, it kind of made me think about what is the most optimal way of being. And then when I saw patients, I will see certain patients do really well after surgery. They're undergoing 2 same surgery. Mm-hmm. And other patients are not doing well. And again, it has to do with so much has to do with precision and how much less trauma. And just to tell you something a little bit, this is going not, it's not about my past, but just to let you know that people think that when you're undergoing surgery, you don't experience pain, but I'm letting you know that your body feels the pain.
Right.
So, there was a study in Boston, in the Boston Children's Hospital. This is a Harvard hospital, where they looked at infants who are undergoing open heart surgery. And they wanted to know why certain infants die and why certain infants survive. And they found that, so that during the surgery, they measured all the blood parameters. They measured all the factors. And they found out the infants who survived had significantly less stress hormones that were released. So before, we didn't know that babies or human or we experience pain. But through that study, we realized that, oh my goodness, our stress hormones are like massively elevated. And unfortunately, infants can't tolerate massive spike in adrenaline, norepinephrine, things in that nature. Because what that does is that it really shocks these organs. And then the blood pressure spikes, vessel starts clamping, and then they start getting organ failures. And so, so when I was in medical school, I realized there's gotta be a better way, it is, how can we improve? So that's what made me interested in always trying to make something better. And I think if I wasn't an immigrant and if I had such a great upbringing, then I wouldn't think always like, how can I make this better? Because I was always like, my parents were tired. So I kept on telling my parents, you know what, I'm going to work. So why don't you, sleep a little bit more. So, so I always try to say, what can I do to make the solution better, the problem better, rather than, there's a problem, status quo, there's nothing we could do because that's just the way it is. I always felt like if I don't work at my parents' door, then it's only them that can work, right? So if there was a robbery middle of the night and we get an alarm clock at 2, 3 in the morning, I would argue with my parents to see who would go. And I would always say, I'm going to go and check out the store. You stay here because they don't have a gun. I don't have a gun. I'm only a 16-year-old kid driving there. What can I do? Only thing I could do is turn off the alarm and hope that the burglar has already left, So it just kind of ingrains in you to think like, okay, you know what? I want life to be better. And as a doctor, I look at myself as a doctor and my patient as, again, like as a guide, or maybe even as a parent, saying like, how can I provide the best situation for my child, And so that's what motivated me to take away the risk of surgery.
Will, you want to ask one last final question or do a follow-up on the way out?
Yeah, I can. Yeah, I can do that. I actually had a couple questions. You guys asked a lot of my questions, including how big were the titties, which is one of the classics on the show. But no, I mean, like just going through some of my notes here, like, yeah, I would agree that perceived versus real risk is a big thing. I don't even think we can, when you talk about medical error, I don't think we can even put that all on the surgeons. Like when I looked at this for my latest book, it was just a bunch of things like misprescription, seniors were dying in the hospital, there were people that were injured in surgery. But the point Charles was making is that was, I think, the number 4 cause of death in the USA.
Yeah.
Just
Nobody
going
knew about
to the doctor. And this isn't really on the medical profession in every case. It's just we think about these exotic risks, like fighters from another race or something are going to attack you. No, you're just tooling around on the highway. 50,000 a year.
Hunting you down.
Yeah, you go to the hospital, you're recovering slowly because you're old, 250,000 a year. So that's absolutely right. Like the things you can do to stay alive are stuff like eating less of bacon, going to the gym, giving up beer or amphetamine. I mean, it's that sort of stuff.
Right.
In terms of the questions I had, how do you pick a good doctor? You kind of went through that, ratings. I mean, how much they seem to care. Is AI gonna fix this? Perhaps. I don't think we know.
But I think an AI thing might go on the other end for his profession. Like he might get more business because they keep putting up these AI images of models. And so if people are electively saying, I want to look better and I want to look like, it used to be I want to look like Halle Berry. Now I want to look like that AI version whoever, right?
I actually, we could do an episode on this with a feminist or something, but I actually think this is a problem for dudes because people are watching everything from porn to this virtual reality
And they
crap.
think
So
everybody.
it's this whole idea of like women are mid. People are describing like Margot Robbie and Zendaya as just ordinary looking women,
Right, yeah.
comparing them to anime characters. But one actual question I do have for Dr. Kim that's quite serious. What do you think about the quote unquote woke trend in medicine? Like when you describe
Oh,
your
yes.
background, like I've been doing some reading
the
on this, and I
training.
mean, there are medical schools that are thinking about making some of the boards pass fail, describing their number one goal as diversity no matter what. I mean, I frankly think this is ridiculous, but as a doctor, what do you think about
And
it?
you're right. And you made a point about how to pick a doctor. You talk about the better medical schools are good because of the rigor it takes to get in. But I don't know. Is that still the case?
Well, like the last comment from me, but like the UC system just got rid of the SAT. That doesn't directly impact medical school, but I mean, there are lawsuits that are going to be brought, in fact, in large part by Asian American parents that I've done some advising on. I mean, like it's so what is the impact of this on medicine?
Right.
Yeah, I mean, the way I look at it is that, so I understand because my niece and my nephews, they went through that and they're still going. I have a lot of nephews and nieces at that age right now. And because, my siblings were much, they're older than me. And so it is very unfortunate. And, I think, we're dealing with, okay, cosmetic surgery, plastic surgery, this is not life or death, right? Now, if it's done poorly, it can be life or death. But I mean, in general, medicine a lot of it is pretty serious stuff here. And, I think that when we're dealing with this type of serious things, we want the best people who is, most qualified. And I think the thing is that we should be colorblind when it comes to something as important as life and death. And so, I mean, again, as I said, medicine, I really believe that it should be a calling, and people should do it because they really, really want to help people. And if you try to just do it just to make it into like, racial diversity and things of that nature, then I think overall, I mean, people are going to suffer. So yeah.
All right. Well, I could go on. I didn't even get to your career. If you got a minute, you want to tell me the difference between the Korean and traditional plastic surgery, because that was interesting too. That you said
yeah.
that there are advances because in all the schools you also spent some time in South Korea. We can finish on that. What is the difference between the two, and why do you think that may be a better way to go than traditional plastic surgery?
Yeah, so so there are more plastic surgery being performed in Korea per capita than any other country. So and the reason, so people are like wondering like, why is that? So people think of Korea as like, K-pop, K-drama on Netflix, things like that, or K-beauty product, things like
The
that.
movie Parasite. Yeah.
So dead people locked in a room? Oh, I'm sorry, go ahead.
But in Korea, what Koreans kind of really think about Korea, what's unique about Korea is plastic surgery. So I think in America, they're like, oh, Korean plastic surgery? Oh yeah, I heard they do a lot. But in Korea, I mean, plastic surgery is just humongous, right? It's gigantic. And then you have to understand, like, so what type of people are Korean people? Like, why are they so into plastic surgery? And if you know Korean culture is a very relatively conservative culture. They're not the people who are like out there doing crazy things. They're, and then you're like, why are they so into plastic surgery then? And the reason is because the plastic surgery done in Korea is done at a much, I would say, at a higher level. I'm also a assistant. I'm also a clinical faculty at. So I'm at UCLA, but I'm also a clinical faculty at Seoul National University, which is the #1 university in Korea. And so I know Korea quite well, and I not only because I was there, but I go back and forth. But so what it is that in America, plastic surgery is a lot of it is just kind of pulling, the nip tuck, kind of like you just pull and so people look very unnatural. Whereas in Korea, the surgery is everything is done in such detail. So what I mean by that is that even you do it just looks so natural because they're not relying on that pulling method. So they're releasing everything and then repositioning it. Every little area is touched. So for instance, if you're doing like a blepharoplasty, which is eyelid surgery, typically in America, surgeons will just kind of cut the skin and they'll just sew it back up. Your skin is hooding, so they'll sew it back up. But in Korea, they'll reset the fold exactly where it was, and they'll stabilize it. So it's like, imagine you have clothing and then you're just cutting it, and then somebody is just re-sewing it, versus a seamstress going back and sewing the edges of the seams perfectly back in, so that the clothes just look exactly the same as the way the manufacturer wanted it to be. And so that attention to detail, and also like things like we make the eyes wider, brighter. We are cutting the bone. We're just hitting every aspect of it so that there's no stigmata, so the patient doesn't look unnatural. And if you look at the American celebrities right now, and who are on like social media, some of them just look really, really, unfortunately bad.
I was going to bring that up, doctor, because there's something going on with lips where I'm like, what are women doing to their lips? Like they look so fake, like alien. And the weirdest thing is when you see a woman and you have no idea how old she is. That I've seen women where I've seen like a 21, 22-year-old girl, and she looks like she could be 45 with plastic surgery. And so that there's just where I just had to vent.
They're not going to Korea.
Yeah,
I know that obviously.
The lip is just because I think that is just because Earth is easy entry. So what I mean by that is that lip injection are done. A nurse can do it. A physician assistant can do it. A non-plastic surgeon can just do lip injection. So many people are doing it, and they're creating such terrible lips, right? But again, it's like, I think what people are forgetting is that plastic surgery it should be a work of art and immense athletic performance as well, right? Because you have to have that intense focus to be precise for a long period of time. And I think, in plastic surgeons, Korean plastic surgeons in general, they are hitting every aspect of it so that when the patient is done from surgery, they don't look unnatural. And so the friends see it and like, oh, you look great. And then they would say, okay, so what do people want? They want to look great. They want to look younger, right? But they don't want to look unnatural. Right. So if you could achieve that, then more people in the society would want it. So if the result is not great, then obviously that's not going to happen. Yeah.
All right. Well, he is Dr. Kenneth Kim, board-certified plastic and reconstructive surgeon and assistant clinical professor at UCLA and Korea's top national university and all the other colleges. Dr. Kim, thank you for your time. You've been great.
Oh, thank you.
I got a country to say, God bless the US of A, land of the free and the home of the brave. God get all of the praise. I got a country to say, cause I'm Patriot J and I'm saving a day.